Hi, my name is Dr. Jim Park for Care Animal Hospital. Preventive healthcare exams are an important part of keeping your pet happy and healthy. People are always asking me, what goes on during one of these preventive healthcare visits, and why are they so important? Well, let's take some of the mystery out of the preventive healthcare visit today. Follow me back in the exam room, and we'll review the process together. This is Cherie. She's here for a preventive healthcare visit today. First thing we're going to do is look at her face, her eyes, ears, and nose. Make sure there's no discharge or any abnormalities there. We're going to take the otoscope and look down deep in her ear canals. Ear infections are very common in dogs. This allows me to visualize everything in the ear canal and also the eardrum. The next step is I use a transilluminator to look at the surface of her eye and also the front portion of her eye. Make sure there's no discoloration, injury, redness, drainage. Now I'm using the ophthalmoscope to look at the retina, which is the back portion of the eye. Allows me to see if there's any abnormalities of the part of the eye that allows her to actually see. Next, we look at Cherie's nose. By looking at the nose, I can detect certain conditions such as dental disease, upper respiratory infections, tumors, a lot of good information by looking just at the nose. The next step is to look at Cherie's mouth and look at every tooth, pull up her gums, look at the health and moisture of her gums, make sure they're nice and pink. Also, obviously, I'm looking for any tartar on her teeth, any chips or fractures. If she needs a dental cleaning or any dental work, this is a great way to determine whether that's necessary. Next step is to feel Cherie's throat. Make sure that her throat is normal sized and she doesn't cough, which could be an early indicator of a respiratory infection. Then I just move my arms around her front legs, and then I let my hands explore her mammary glands. And then I also come back and feel her back legs and make sure there's no pain or any loss of muscle mass, which could indicate arthritis or joint problems. Next step to the exam is to feel her belly, because during this visit I may be able to decipher whether she has a mass that might be cured with surgery or medication. It's a very important part of the preventive healthcare visit. Next step is to lift up her tail and take a peek at her rear end. So just take an external view and make sure they're healthy and there's no redness or discharge or anything like that. If a patient has diarrhea, I may end up putting a glove on and doing a rectal exam to make sure that everything in there is okay as well. Throughout the exam, I'm palpating Cherie's lymph nodes. The body has multiple lymph nodes. The biggest ones are under her chin, in front of her shoulders, under her armpits, between her thighs, and behind her legs. Feeling her lymph nodes are a great way to detect early signs of infection or even cancer, and another reason why preventive healthcare exams are so important. The last part of Cherie's preventive healthcare exam is to check her skin overall. From the tip of her nose to the tip of her tail, I'm looking for any signs of hair loss, any redness, or areas where she might be licking, which could be an indicator of disease. Regular preventive healthcare visits for your pet are important for the same reason your physician and dentist recommend them. If you can detect a problem in its early stages, it's more likely to be treated and resolved with less expense, less difficulty, and better success. For more information on pet preventive care, visit avma.org.